with, is research important to get into medical school? No, it isn't. Okay, you do not have to do research in order to get to be that much more competitive. It will make you more competitive. Because what does research entail? Research entails giving you a project that nobody else in the world, hopefully, is doing. And can you do certain things? Number one, can you commit to it? Research is not something you can do for a couple of hours a day, like volunteering at a hospital, and then come back the next week. If I tell something like that, if I have a group of friends and say, oh, God, I got to go to the lab for about an hour and a half, 2 hours, and I'll be back, that's an 8-hour ordeal. That's code for 8 hours. I will not be back, it's guaranteed I will not be back in 2 hours. Can you handle that kind of commitment where you're going to have to give up an awful lot of your time to stay inside the lab? Number two, are you going to come back, let's say, at a certain time point? So I'm giving you a growth curve and you have to take a time point every 12 hours. Are you responsible enough to come every 12 hours and take that time point? Problem. And that problem turns into a really big mountain. And then we have more problems. And then it's still going to be when we finish. That's research. Okay? Can you have the fortitude when you have working so hard, 6, 7, 10 hours a day, 16 hours a day, PhDs, and go on for months at a time and have no data? Now, that's not the same as negative data. I mean no data. So I'll give you a good example. When I was in graduate school, my second year was pretty much worthless. I had to do my classes and my oral exams, so that got through, but the actual research was worth it because I was working with bacteria to try to isolate a specific protein for HIV. And there's a virus that we call a phage. A phage is a virus that really screws me up because if I'm trying to get a lot of protein in order to isolate it from the bacteria keep breaking down, I'm never going to get it. And so what happened was there was an actual contamination from the floor above me. So for 8 months, I couldn't even grow bacteria. People grow bacteria in the mouth. You eat a hamburger, don't brush for a couple of days, you got a whole bunch of bacteria. I couldn't grow any bacteria. So that means for 8 months, I had nothing. No data, nada. I had to figure out what was going on. A lot of people quit because they can't handle that. I've had 3 graduate students who have actually quit the master's program because they can't handle the fact that they have to put this many hours in and have nothing to show for it. So it's a completely new way of thinking about how and what you're going to do in this process. Now, does doing research help you into getting into medical school? Yes, it does, because it shows a lot of things. It shows, number one, you can take on a project. When you take on a project, you're giving your word that you will see it through to the end. You don't get discouraged easily. If you get discouraged easily, you don't belong in a graduate program or a medical program. It shows you that you can use and you can analyze. You can take data and analyze it to form conclusions from it. This is called independent thinking, and that is hard. It's really hard. It's very much like understanding a concept. And a concept is taking all this information that you have and being able to utilize it to answer a problem. If you can't do that, not only do you don't understand concepts, you don't belong in medical school, graduate school, or any other school. Because you're forming the basis of your knowledge on is memorization. And memorization is useless. I have 2 nephews that are 11 and 12 years old. I can easily tell them, have them memorize the structure of DNA and draw it out on a piece of paper. But that doesn't mean they're going to understand the regulation, the expression, the replication. They're 2 different apples and oranges here. And that's what we're trying to decide with research. Can you distinguish the difference? So you're going to take all the knowledge you've actually learned in class. So you're taking book knowledge and creating applicable knowledge. applicable knowledge. Can you apply it in the lab? Science writing is completely different from English writing. English instructors hate scientists when it comes to writing because we can take every rule that we tell you in English and we break it. My favorite punctuation is the semicolon. I can use 10, 11 of them in one sentence. I'm perfectly fine with that. If you read some of the primary journals, you can see entire paragraphs are made up of one sentence. English writers hate that. Okay, so writing in science is very difficult. And one of the things that you have to do is you have to take your sentence and put as much information in it as you possibly can. Because when we publish our papers, we have a set limit of characters. So that means every sentence has to be chock full of information. And so that writing like that is very different. And then finally, you're going to have to present your data orally, right? Somewhere along the line. So you have to communicate very well. If you're in the operation or in an emergency room and you can't communicate, that's a problem. You know, you have the chest opened up and like, I need something. You know, it's like, that's the worst thing you can do, is not be able to communicate. So that means that you have to learn how to not be shy. How many people here like public speaking? Yeah, pretty much nobody, right? You have to get over that public speaking. When you're in class, the very first thing, if someone asks you to give a talk, your hand should go straight up. Because that's important. Being able to communicate what it is you're trying to communicate. When you're talking to patients, patients usually don't have a clue what's going on. And they have to be comforted. They got to know what's happening to them and what are the repercussions of it. How can you help them? Can you help them? And that's going to be very important. So research tells you about all of these particular types of situations and helps you to concentrate them and strengthen them. Now, independent thinking, I would say, is probably the most important part of research. When someone comes into my lab, I teach them what they need to know, and they have to have certain prerequisites, and they are able to do some experiments. What I don't want is, I don't want them to come to me in every 2 or 3 minutes and say, okay, what do I do next? What do I do next? What do I do next? That's not independent thinking. That's coming to me and having me direct them every step of the way. Hand-holding doesn't work in research. You have to be able to say, okay, this did not work, but what do I know? I know a lot. How can I figure out what's the next step? If you have a gel, here's your standards, and you have a band here, but you're expecting a band here, well, I expect you to come to me and say, hey, I have a wrong size band. Here's what I think is happening, and here's what I want to do to try to figure it out. Now, that's great. Now, if you come here and say, okay, I have no idea what it is, what's going on, and what am I going to do? Well, that's me telling you how to fix the problem. I want you to tell me how to fix the problem because I want your mind, I want to see how your mind works. Freshmen come in, well, not I don't use freshmen. People that just entered the lab come in, and one of the things they do is they're kind of shy about coming to tell me that they did something stupid. Maybe they ran the gel backwards, so instead of having, oh, you've seen that, huh? The minus here and the plus here, they switched it, and so your DNA here is going to go right off the gel. Okay, and then it's like, oh my God, that was really dumb. Now I got to go talk to them about it. I am okay with that. Because what happens is, if everything goes right, you don't question, right? You don't, you just like, oh, well, it worked. This is great. Let's go on to the next step. But if something goes wrong, then you tend to question it. You tend to take a step back and say, okay, why do I have a band here? What could have caused it? Was it me? 99% of the time, it is you. Okay. one of the things, when about 6 months ago, I was on a master's thesis committee, and we were talking about PCR. PCR is a way of amplifying very slow, small concentrations of DNA. And one of the questions I asked him was, how did you do the PCR? And he said, oh, I put all the components in this little test tube, and I put it in the machine and hit start. And I'm like, no, that's what the machine did. What is the process of PCR? And he didn't know, and that's a major problem. Because what does he do when he's relying on the fact that the machine did all the work? But he hadn't a clue what was going on in the actual amplification process. That's going to get you nowhere, saying, how did you do this? Oh, the machine worked. You know, I pressed start, and well, why didn't it work? Oh, God, I guess the machine was unplugged. That's something that you got to take, and it's hard to take responsibility for making mistakes. But that's how you learn, you know, own up to your mistakes. And failure is a wonderful thing, right? Because you learn from failure. You don't learn as much from success as you learn from failure. The best thing to do is brush yourself off and say, okay, not going to do that one again. And obviously I did this too. When I first started in the lab, I put it in the wrong direction, and I went to check my DNA, and I knew I had gobs of DNA. And I'm like, where the hell did it go? I had no idea. And then I went back and, well, there it was. I put the darn leads wrong. And that's, now I know that I've never done that mistake again. So you learn from your mistakes. And this is why research is important for medical school per se, because it teaches you to think at a higher level. Okay. Volunteer work is important because it means that you have empathy. It means that you're learning what the hospital surroundings are like. You're following doctors, you're following nurses, and you're saying, okay, now I see what's going on in the hospital. Research is different from that. Research is saying, okay, I'm going to put you out on your own, and can you actually have the fortitude to think beyond what basic thinking is happening, memorization. Can you think so you can actually come up with your own concept, your own ideas, and say, I can make this thing work? That tells medical schools, for example, that you really do have a passion for what you're doing, and you can think above what other people are doing. And that's where medical research comes into play, trying to get into medical school. It's also interesting because it's a different way of thinking. Now, when I was coming up, I started out in the pre-med stage. And there's a couple things that turned me against the pre-med stage. The first thing is that I don't do well with blood, come to find out, especially my own. And the smell of it disgusts me. Have you guys ever really smelled blood? That iron smell? Oh, God, it's disgusting. And then I used to work for a florist, and the actual owner of the florist was a surgeon. And I sliced my finger all the way up, and I'm like, no, I did do that. That was a quick. We have in the floral business, you have to put the flowers in these ridiculous cellophane type things. The cellophane, these are about 350 pounds. You need two people to work on it here, one on one side and one on the other side. So the manager that I had was a really big guy and really big fleshy hands. And the one thing about this is if you don't put on the cellophane at exactly the same weight coming down, your hands are going to slide, and there's a huge blade here. Okay. Well, he didn't put it down evenly with me, and so his hand slipped and went right into the blade and sliced his hand all the way up. And I'm like, okay, well, that's going to need stitches. That's something a Band-Aid isn't going to do. I had to call Gino, who's the surgeon. His offices were just down the street. So we went over there, and this was on a Saturday, so his nurses and all those people who help him weren't around. But he knew I wanted to be a medical doctor, or at least a medical student. So he said, hey, this is a great opportunity. You can help me. So he brings me in, and he opens up, he pulls apart this wound. So there's a big gash wound, and all the fatty deposits are there, and blood's gushing up everywhere, and I'm doing this. Yeah, I can help you. And he's seeing that I'm ready to pass out. He goes, why don't you come and get me some gauze and some stuff in the back? And I said, that's a good idea. I can do that. So I go in the back, and he comes back out, and now he's putting Novocaine and Xylocaine in there, and he's just sticking it in there and jamming it. I'm seeing spots before my eyes, and I know I'm going to go down. So I'm thinking maybe the medical field may not be for me. And I was thinking of that. And then that happened at the end of the winter quarter. Then at the beginning of the spring quarter, I had to come and I had to think about 2 classes. Now, back in the 80s, we had hematology and immunology. Hematology back then, and we were partners, we would have to draw each other's blood. Now, no offense, I don't trust a phlebotomist to draw my blood. So trusting a student to draw my blood was not going to happen. So I ended up taking immunology, and immunology was outstanding. Now, what she did, Maria Nieto, came in and she taught me the experimental side of immunology. And to me, that was fascinating, absolutely fascinating. So I changed my field from pre-med to PhD. So you really want to have a good idea of when you're going into medical school, are you ready for all the different trials and tribulations that you really have to go through? Because it is tough. When I got into the medical, into graduate school, I had to teach medical students and I had to teach graduate students. The medical students did not know how to study. They knew how to memorize, and that was a major problem. Can you flunk out of medical school? Yeah, it's very hard, but you can't do it. Here's the way people get out of medical school. Number one, they have to, usually take 3 courses in an anatomy course. So your anatomy course is really rough. You take the neck down for the first 6 months and the neck up for the next 6 months. And you're with your cadaver about 8 hours a day. So that leaves the rest of the time for your classes. You have 3 classes usually. And you can take like medical immunology, medical biochemistry, medical physiology. You have to learn about 50 or 60 pages per night. And then you have a test on them 3 days later. Okay, that is very rough. However, if you have to go back and relearn everything that they already thought you knew because of your undergrad, that's where you can't pass the exam. They give you 3 or 4 chances to pass the exam, but if you have to go back and relearn the information that you should already know, that's when you can flunk out of medical school. Another problem with getting out of medical school is, it's 24/7. And when I mean 24/7, I seriously mean 24/7. 24 hours a day, 7 days a week, you are thinking medicine. If you're not studying medicine, you're dreaming about medicine. Okay, and what do you, and medical students used to crack me up. Like when I was in graduate school, one of the big TV shows was ER. Did you guys ever remember ER with George Clooney and all? And we were watching ER. They came into the ER, and they grabbed these gloves and everything, and they're like, we would never use those kind of gloves. And it's like, really, seriously, is that all you, from all your classes, that's what you got, is the fact that you don't use those kind of gloves. Oh my God, so it's a different way of thinking how you're going to push yourself through. Research is good because it tells you that you have the fortitude to handle very rough situations. And when you get into medical school, it's a very rough situation. You have to grow up extraordinarily fast. Albert Einstein started in August. In the 3rd week in September, students were already doing pelvic exams and vaginal exams. You have to be able to be that mature to go in there and start understanding and doing that. This research helps you to get to that maturity. So do you need to do research to get into medical school? No. However, it sets you up for success in medical school because you learn so many different characteristics. It matures you. Okay, and make sure that, because I'm not the type of person that's going to go around and say, okay, why aren't you here today? Why aren't you here today? Why aren't you here today? I give you enough information that you know exactly what you have to do. You should be able to come to me within a few days and say, I either have it or I don't have it. And if you don't have it, why don't you have it? Give me some information why you think you don't have it. And that's where research is at. That's the strong point of research. Another thing is if you do very poorly in your undergrad, a master's program, a master's degree is a nice way of starting the slate clean. Because you already had your undergrad, right? You're not going to be graded on your undergraduate performance anymore. So now you start in a master's program. A master's program, you have to take a year of classes. You have to maintain a 3.0. If you don't maintain a 3.0, you will be kicked out. You have to take graduate courses. Graduate courses are much, much worse than your upper division courses. Because what is a master's? A master's is saying that you're mastering a topic. A PhD or an MD, you're mastering a discipline. You're going to be a professional. If you want to be a professional, you have to work at that professional level. And so that's why it's wipes the slate clean. You have to maintain a 3.0. Usually you start your research in that time. You have to write a proposal. If I believed everything that I read, then Elvis is living under the underpass under A Street. You know, you can't believe everything. So question. But the only way you're going to question is to understand the material. So in this case, the very first thing I do to students in my lab is I give them a bunch of papers. And they have to read those papers. If you're into an undergraduate program, you should be able to not graduate your program until you've read at least 100 papers. Now, if you don't understand the papers, what I'm talking about, if you haven't had a chance to be exposed to them yet, go to PubMed. I'll Google this up. PubMed, Google Scholars, Medline. All of them will give you these, Tesco, I think is one of them, will give you a bunch of papers depending on the topic that you're interested in. So let's say you're interested in HIV. Put in HIV1. Let's say you're interested in a particular protein like reverse transcriptase. You put in reverse transcriptase. And then you're going to have a bunch load of different types of papers coming up. Don't worry about the reviews. The reviews are different types, it's written differently. But pick up a couple of those papers and read them and just see how difficult they really are. The only difference between the people that I work with and what you want to be as a medical doctor or pharmacist or whatever is, I read journals that are involved in basic research. You're going to be reading stuff in clinical research, which includes journals like JAMA, which is the Journal of the American Medical Association, Lancet, New England Journal of Medicine, or your related journals on specificity, let's say spinal cord journal or something like that. That's the only difference. So you're going to have to understand the primary literature. You should all start being adept at it. Medical schools have what they call grand rounds. And grand rounds is medical doctors and medical students, especially medical students now, where they're starting to get into the hospitals much sooner, you don't have time to keep up on a lot of the medical literature. So that means you're going to have a rotation. So I'll say, next week, I want you to give a talk on hypercholesterolemia and what's going on right now. So you take 5 papers on what's going on medically in hypercholesterolemia, and you're going to give a presentation of all 5 of those papers to your peers. That way, they don't have to sit down and reread these papers because you're giving them all the relevant information. So you have to really understand how to read these papers. It's very important. A lot of students will say, oh, okay, this is just a question of utility. It's just busy work. It's not busy work. The instructors in your science classes really know what they're doing, whether you think so or not. They really understand what they're doing and why you think you need to do it. And that becomes very important because remember, you're mastering a discipline, becoming a professional.